Okay, for the staff, whoever is the first person in, come into the closet, de-arm, turn the vacuums and the air and the water on, and there's Clorox wipes here. Everything needs to be wiped down after you touch it. For the staff, when they come in the morning, they need to have a mask on at all times. Come in, you need to have your temperature and your oxygen levels taken. So again, Purell first, take your temp, do your oxygen, write your name, and you need to log it in every day.
Once the patient arrives, they'll walk over towards the front desk and use the hand sanitizer immediately. After this, we'll take their temperature and their oxygen levels. Any patient with a temperature 99 and above will be asked to reschedule.
97,
Any patient with oxygen level 90 and below will ask to be rescheduled.
In sterilization, we have our sensors on this side. This is now going to be the dirty side. So once you use your sensors, you're going to put them on this side. Now we're going to add another side. We're going to mount new mounts for the sensors on this area. And this is going to be the clean side. So they'll be wiped down by whoever is in sterilization. There'll also be a camera up here in this area here. And it's just going to show us what we're doing wrong, what needs to be changed, just to let you know that that's going to be there. Hygiene rooms, no more ultrasonics. Those have been taken out. Nothing on the sills and nothing on the computer area.
So here we go, we have your N95 or KN95, a type 2 mask over it. You can put type 1, type 2, type 3, goggles, and the face shield. Gloves, cuffs, everything is covered. Make sure the gloves don't have any hole on it. That's how you're going to be, okay? So this is a dirty room. First, the things that we have, we can throw the trash out. Goes in the trash. That's Pyrex. Get some of the tissue from the wall. 3-fold tissue. You get 3 of them, so it's nice and thick. What you want to do, you want to soak them really well. So take your time. It's not just spraying it a little bit, you want it to really, really be soaked. Now this is good to go. What you can do, you can wipe this and take it out. Because the light, we don't want to spray the light. If the light is soiled, you can gently rub it and put it on the side. You can get to that later. Cements, things that have been used, you can wipe them, put them on the side. Core buildup, same thing. If you have to change the tip, that's going to go to the trash. Wipe, rest of it, you wipe it really well. Any trash that you see is on your way, throw it out. Again, edge, change the tip. Make sure you don't leave the tip in there. Those are disposable. all the instruments that have been dirty, if you see any cement in there that needs to be wiped, clean it as much as possible before you put it back in there. Line them up. Don't forget the saliva ejectors. You can take these off. They're usually 2. And of course the handies. Take that off. And so your cassette is done. You can close it. Make sure nothing is sticking out so it doesn't poke your hand. Your handpiece goes in there. If there's any burr block, it goes on it. These are your trash. These get sterilized. So these needs to go out with you. Going to the suctions. Wipe it very well all the way on the tubes. Get it in here. All right. Then you remove the barrier. And we go to the chair. Take the chair stuff out. This is your wipe, so it's okay to drop it in there. You're gonna wipe everything with that. I just can't wait for Virginia to see this and start shaking her head. And, oh my God, don't say that. So as you can see, this is really wet. It makes the chair wet. It's not just moist. So you want to leave it like that. Handles where the patient touch everywhere. The back of the chair, if it was too much of stuff going on. It's about this chair. Anything that you think the aerosol gets on it, and you have to touch it again, it needs to be wet. These handles. Don't forget about this guy. The doctor touched this quite a bit. In between in the patient room is okay. Don't forget to wipe these. That's where the coat gets hung. And this virus can be on the clothing, so these needs to be wiped too. Again, if this gets dry, go for it. Now, on this side, things that we are going to touch again, of course, we always do the light and the switch, although it was to the back. X-ray unit, we touched it, so we need to kind of, the areas that we touched, wipe the X-ray unit. We cannot spray the X-ray unit, so you have to make sure you wipe it really, really well everywhere. The apron, if it is sitting in the room when you are working, you need to wipe it because this aerosol sits on it. So you can go ahead, wipe it. And don't forget it has 2 sides. So you can flip it around and wipe the other side. The best thing is that we're going to put some plastic in here so you can wipe this side. If you think you don't need X-ray, you can always take it out of the room before you start the procedure. That's going to be easier. If you need it, stays in the room till the end, then we wipe it. Here is a assistant who was already in the room, is already dirty with this procedure. So just trying to clean up to get the dirty stuff out and make everything clean before leaving the room. We are going to have an air purifier which is going to clean the air while we're still working in here. And at this point when everything is white, what we can do, we can spray the surfaces. Things that you think, maybe I didn't wipe it so well. And makes sense, we don't want to spray the light because this is going to get covered with plastic again. So please don't do that. We pick up our tray to go, wipe underneath the tray, make sure we got this surface as well. And we go. We don't touch anything or drop glasses dirty. You're dirty. We move, we try not to bump to anyone. We go to the sterilization to the dirty side. Whatever needs to happen here happens here. You can drop this. Take our gloves off without touching your hands. Two ways of doing it. One, you pull it out from here, and then put your finger in here. Pull it out. Okay, now the room's sprayed and every surface is wet because our cloth was really wet. We let that sit. If you want to take your face shield off in the room, you can take your face shield off. If you want to spray it, you can spray it. But this face shield, because you touch inside of it, is dirty now. You're not going to be wearing this again. Your gloves are there. Just we have to be careful what you touch with your gloves. If you want to spray this and let it sit here, you can let it sit here in the room and move on. Took your gloves off, we take our mask off, our hands are clean. The top mask can go out in the trash. If your inner mask is not wet or it's not soiled, we keep it on. You don't have to take that off, you just keep it on. Sanitize your hands. And you take your clothes off. You can always touch the inside of your clothes as you're taking it off, but not the outside. And you can throw it out. That's done. You can wash your hands. The best way is to just wash your hands. Inside, outside, in between the fingers, your wrist, because you never know if anything slipped between the glove and your hands, your wrist. In between your nails, the best would be to keep your nails really, really short, but scrub in between your nails. It shouldn't take more than 20 seconds to do this. There we go. Keep in mind, don't touch your hat. Don't touch that, because that has been in the room. It's not going to touch the patient again. Remember the white gloves? We're going to put the white gloves on when you come to set the room up, so we know this room is almost clean. We get another tissue from here. Put Virex on it, just a little bit, so it's a bit moist. Don't have to soak it. We already did the soaking. We just want to make sure the chair, now we can rub it nicely in there so if the patient comes and sits on it, it's not wet. Wipe all the areas that you already wiped, just to make sure this is not wet and it's clean, and this has Virex on it. This needs to be wiped and put away. Now they're clean. And watch the surface area to be washed, so all this clean stuff can be sitting here or on the other side. So we can put them away. These guys, you have to recap them. When your hands are clean, you recap them. Your mask, you can wipe it. This is a mask you're going to store for a couple of days, or even half hour if you're in a rush, if you're short of mask. As long as it dries. It's clean now because we have been wiping it off. It can go in your cubby, and the room is ready to be set up again. So don't forget, when you come to the room, you want to have a moist Virex. Go over everything one more time, and you go.
Have some shelving put here to place some of our PPE that we'll be using, our shields, masks, etc.